Let's talk about surgery infections being caused by bacteria in the air. In fact, I want to talk about this air barrier system. This is a new device that's used to reduce the number of infections post-surgery because hospital infection rates, they're high. There's up to 780,000 surgical site infections each year here in the U.S. That costs $10 billion plus, not to mention what patients have to go through. And many hospitals, they were built a long time ago. Maybe they don't have good air ventilation. There were no guidelines. So we have orthopedic surgeon Dr. Terry Clyburn with us in our exam room using this device. Thank you, Dr. Clyburn. Tell us a little bit about how this works.
Thank you, Travis. Thank you very much for having me. We've come up with a simple concept here. We've been 10 years in development. We've used this product now for 6 months. It's turned out to be quite simple. The concept is this. We have a device that draws air from the air in the operating room. And as you just mentioned, even the air in our operating rooms has a lot of bacteria in it. This product will take that air, put it through a HEPA filtration system and eliminate that bacteria. We have a sterile hose, a sterile nozzle, and we place this nozzle on the patient near the area where we're going to make the incision. And we have Fallon here who's volunteered to be our total hip replacement patient, and she looks just like the average hip replacement patient in Houston. I promise you that. So that air flows right over the area of the incision, and it prevents the bacteria that's in the air from coming down onto that area. As you can see, with the air barrier system in place, the smoke, which represents the air with bacteria, is swept away from the wound. But when the air barrier system is turned off, the smoke falls right down onto the area of the incision. And as you can see, when the air barrier system is on, it reduces the bacteria count by about 84%. When it's off, the bacteria falling down into the area of our surgical wound. So it really is a simple idea, and it works very well.
So what we're learning so far is air can be good for your health or potentially bad for your health. And what you're going to see here is actually a Petri dish. With it on, 97% fewer bacteria were grown on these Petri dish. That's pretty remarkable when you talk about the fallout onto a surgical field. Now, Dr. Clyburn, this technology is not available everywhere. What can you do at your hospital if you're about to go have a surgery to try to minimize the surgical infection risk?
Absolutely, Travis. Right now, this is only available in Texas, but it's rapidly expanding to other states. The most important thing here is for all of your patients to be informed, and that information is available. They have to give you the information about the infection rate at the hospital you're considering for your surgery. Be informed.
And also to play the no fear factor, because in the ORs that I work in, there's a lot of things, a lot of systems that are in place besides the antiseptics, a lot of sterile fields. When we use antibiotics now, basically they've done a lot of studies about how important that is in combating infections. So there are other things being implemented to fight the infections.
And hospitals are doing a better and better job, like Dr. Lisa said, of preventing these infections. Dr. Clyburn, thanks so much.